Hello friends, the topic of this video is mediastinum. So in this video we will learn how to define mediastinum, what exactly is mediastinum, the various subdivisions of mediastinum, and then the contents of these subdivisions of mediastinum. What is mediastinum? Let us see that. Now this is a coronal section through the thoracic cavity. We can see here these are the lungs covered by the pleura, and this is the diaphragm below, and above will be the thoracic inlet, right, which will connect the thoracic cavity with the neck here. Now we can see between the two lungs we can see a green area. This green area is known as mediastinum. So mediastinum is the area in the thoracic cavity located between lungs enclosed in pleura. So lungs we can see, we have already seen they are enclosed in pleura that contain almost all the main structures and organs of the thoracic cavity except the lungs. Let us see what are the boundaries of mediastinum. So this is a sagittal view and this is a cross-sectional view, and you can see here this is the mediastinum and here this is the mediastinum. So we look at the boundaries. Now superiorly it will be bounded by thoracic inlet, and we know the boundaries of thoracic inlet. Anteriorly is the upper end of the manubrium sterni. On the sides we have the first rib, its inner border, and posteriorly we have the upper border of the body of first thoracic vertebra. So this will be its upper extent. That is the upper extent of the thoracic cavity. So mediastinum has the same upper extent as the thoracic cavity. Similarly, the lower boundary will be formed by diaphragm, which forms the lower boundary of the thoracic cavity. So these are the superior and inferior boundaries. Let us now look at anterior and posterior boundaries. Anteriorly, it will be bounded by the sternum, which can be seen here, the three parts of the sternum, manubrium sterni, body of the sternum, and the xiphoid process. Here in a cross section, we can see a section of the sternum placed anterior to the mediastinum. Then posteriorly, we have the 12 thoracic vertebrae. And here we can see in cross section one of the thoracic vertebra forming the posterior boundary of the mediastinum. What will be present on sides? That cannot be viewed in this section, but we can see here these are the lungs and they are covered by the visceral pleura, and the outer layer is the parietal pleura. So this part of the parietal pleura which is present on sides of the mediastinum, this is known as mediastinal pleura. So on sides the mediastinum is bounded by mediastinal pleura. Now what are the subdivisions of mediastinum? It is divided into two parts, and how we divide it? By imaginary plane. So the imaginary plane which you can see here, that extends anteriorly from the sternal angle, that is the junction of manubrium sterni and the body of the sternum, till the lower border of fourth thoracic vertebra. So this imaginary plane will divide the mediastinum into two parts, and these two parts are the superior mediastinum and the inferior mediastinum. Now inferior mediastinum is further subdivided into three parts. So let us see what are these three parts. So the first one will be the anterior mediastinum, which we can see here, and this will be present between the sternum anteriorly and the pericardium posteriorly. So this is anterior mediastinum, a very narrow area. And then we have the middle mediastinum. So this will be containing mainly the pericardium, heart, and the blood vessels which will be entering into the heart or leaving the heart mainly. So this will be the middle mediastinum. Just remember, this is occupied by mainly the heart and the big blood vessels. And then posterior to the heart we have the posterior mediastinum. This is between the pericardium and the lower 8 thoracic vertebrae. So this is clear. In the middle we have heart with pericardium and great blood vessels. That becomes the middle mediastinum. Anterior to that is the anterior mediastinum, and posterior to the heart, right, we have the posterior mediastinum. Now let us look at the boundaries of the superior mediastinum. So we will begin with the anterior one. So here it will be bounded anteriorly by the manubrium sterni, and posteriorly it will be bounded by upper fourth thoracic vertebrae, and superiorly thoracic inlet will be there, And what will be present inferiorly? The imaginary plane extending from sternal angle till the lower border of fourth thoracic vertebra. And on the sides, obviously, there will be mediastinal pleura. Let us look at the contents of superior mediastinum. Now you have to imagine, or not imagine, in fact visualize the structures that are present behind or deep to the manubrium sterni and in front of thoracic vertebra. So now you can imagine those structure which will be going into the neck, or the blood vessels which need to supply the head and neck and the upper limb. Those structures will be present, vessels will be present mainly there, and some nerves will be obviously there, and some lymph nodes will be also there. And obviously there will be two tubes, main tubes, one for air, one for food, that is trachea and esophagus. So let us look at those structures. Visualize structures just deep to your manubrium sterni. So we begin with the two tubes. I've already told you these two tubes. So here you can see this will be the trachea and this will be the esophagus. So these are the two tubes which will be present in the superior mediastinum, and they are present deep. Then we have arteries. So let us look at the arteries which will be present here. The arch of aorta and its three branches. So it's simple. Arch of aorta and its three branches. So total 4 arteries. They will be present in the superior mediastinum. Remember surface marking when you have to do. The arch of aorta lies behind the lower part of the manubrium sterni. So these are the 3 branches are. This is brachiocephalic trunk. This is then next to that is the left common carotid artery, and still to the left of that is the left subclavian artery. So arch of aorta and its 3 branches, they will be present in superior mediastinum. Coming to veins. So veins, obviously here, which vein will be present above the heart? The superior vena cava. This is going to drain the blood from the upper part of the upper half of the body, right? So from the head and neck region and from the upper limb also. So let us see which veins will bring that. So superior vena cava and its tributaries. So what are the tributaries of superior vena cava? The formative tributaries are obviously the brachiocephalic veins. So right brachiocephalic vein and the left brachiocephalic vein. There is another vein which drains here, and that is the azygous vein. So some of the books are going to mention this in the posterior mediastinum. It does lie mainly in the posterior mediastinum, but its terminal part, right, that is present just in the superior mediastinum because it enters into the superior vena cava at the level of the sternal angle. So azygous vein. So here these are the veins, plus there is one more vein which will be draining into the left brachiocephalic vein, and that vein is left superior intercostal vein. So these are the veins which will be present in the superior mediastinum. What else is there? Let us see. So which nerves will be passing through superior mediastinum? In total there will be 5. So first let us see here the right and the left phrenic nerves. They have to supply the diaphragm, and they originate where? In the neck region. The root value is C3, C4, C5. So they have to pass through the thoracic cavity. So these are the 2 nerves, that is right phrenic and left phrenic nerve. Then we have this cranial nerve, that is right vagus and left vagus. This is the only cranial nerve which leaves the head and neck region, and it supplies not only the viscera of the thoracic region but also the abdominal organs, right? So therefore this cranial nerve also has to pass through the, you can see here, this is the left vagus and this is the right vagus. So this has to also pass through the superior mediastinum. Then we have another nerve that is a branch of left vagus, and this is known as left recurrent laryngeal nerve, right? So as the name suggests, it is going to go back to the larynx here by winding around the arch of the aorta. We don't have the right recurrent laryngeal nerve in the superior mediastinum. Why is that so? Because the right recurrent laryngeal nerve is going to wind around the subclavian artery, that is in the neck region. So we only have left recurrent laryngeal nerve, right? This has got some embryological basis. Now what else we have? We have thoracic duct. So thoracic duct, if you remember, this carries most of the lymph from our body and is going to drain into the neck at the junction of left internal jugular vein and the left subclavian vein. So that's why it also has to ascend up in the superior mediastinum. You can see in the groove here between just next to the trachea and the esophagus. Then we have some lymph nodes. So lymph nodes around the trachea, paratracheal, pretracheal can be also there, and tracheobronchial lymph nodes, which will be present at the bifurcation of trachea into two main bronchi. In adults, there will be remnant of thymus also present here. So that will be also present in the superior mediastinum, plus the origin of two muscles will be also there, which will be taking origin from the posterior surface of the manubrium sterni. So these muscles are, one you can see here, this is the sternohyoid going till the hyoid bone, and the other one present deep to that, this is sternothyroid going till the oblique line of thyroid cartilage, because they also take origin from posterior aspect of the manubrium sterni. So their origin will be present in the superior mediastinum. Let us revise the contents of superior mediastinum. To begin with, the two important tubes, that is trachea and esophagus. Let us now consider the blood vessels. So arteries, arch of aorta and its three branches, brachiocephalic trunk, left common carotid and left subclavian arteries. Veins, superior vena cava and its tributaries, that is right and left brachiocephalic veins, azygous vein, its termination, and there is one more, that is the left superior intercostal vein. After that, nerves, right and left vagus, right and left phrenic and left recurrent laryngeal nerve. Then structures associated with the lymph, right, lymphoid organ, that is thymus and lymph nodes, plus a tube which drains most of the lymph from our body, that is thoracic duct. So they will be present. In lymph nodes, we'll have paratracheal, pretracheal and tracheobronchial. Remember the word trachea. So here, then we have origin of muscles. Which muscles? Again, because they have to take origin from the manubrium sterni. So sternohyoid and sternothyroid. Now let us see the boundaries and contents of anterior mediastinum. It's a very small space which is present there, mostly filled with the areolar tissue. Anteriorly, it will be bounded by body of the sternum and the xiphoid process. That is what you can see here. Posteriorly will be the pericardium covering the heart. Superiorly will be this imaginary line which you can see here from the sternal angle till the lower border of fourth thoracic vertebra, and below will be the diaphragm. What will be the contents of this? So contents will be the branches of internal thoracic artery will be there, plus there will be two small ligaments. These are sternopericardial ligaments, right, which will be passing from the posterior aspect of sternum till the pericardium. So these are the contents of anterior mediastinum. Contents of middle mediastinum. Let us look at that. As I told you earlier, the main thing that you have to remember is the heart, heart with the pericardium and all the big blood vessels which are either entering into the heart or leaving the heart. Those are the main contents, and you can see here two nerves also which are supplying this muscular structure, that is diaphragm. These nerves are the phrenic nerves. So let us look at the contents of this. So to begin with, heart with the pericardium. Then as I said, all blood vessels leaving or entering the heart. So which are those blood vessels? First is ascending aorta. Next is the pulmonary trunk, which divides into the right and the left pulmonary arteries. That will be there. So these are the blood vessels which are taking origin from the ventricles of the heart. Then we have the veins which will be draining into the atrial chambers. So we have the superior vena cava, its termination. Then we have inferior vena cava, its termination, and the four pulmonary veins. Nerves, as I told you, there will be phrenic nerve. Now why not vagus nerve? Because vagus nerve has gone posteriorly now, right, to the esophagus, right, which lies behind the heart. Remember, the inferior mediastinum is divided into three parts. Structures anterior to heart and pericardium, structures, mainly middle mediastinum with the heart and the pericardium, and the structures present behind the pericardium, they will be present in the posterior mediastinum. So esophagus from superior mediastinum enters into the posterior mediastinum, and vagus, that will be present associated, which will be forming a plexus around the esophagus. So vagus will not be a part of the middle mediastinum, it will be a part of now posterior mediastinum. Plus we will have the deep cardiac plexus also here, which will be contributed by the sympathetic and the vagus nerves. Then the trachea, which you cannot see here, that will be dividing into left and right principal bronchus, that will be also present in the middle mediastinum. Lymph nodes, as I said, tracheobronchial lymph nodes, you can include them both in the middle as well as in superior, because they are present at the junction of division of trachea into two bronchi, which occurs at the level of the sternal angle. Now boundaries of posterior mediastinum. So let us see here the boundaries, 4 boundaries you can see here. Anteriorly will be the pericardium covering the heart. Posteriorly will be the lower 8 thoracic vertebrae. Superiorly will be the plane from sternal angle to lower border of T4 vertebra. Remember this imaginary plane? And inferior will be the diaphragm, and obviously on sides will be the mediastinal pleura. Let us see the contents of posterior mediastinum. Now you have to visualize the structures which will be present in the midline, just deep to the heart and the pericardium, and in front of the lower 8 thoracic vertebrae. So first structure will be the esophagus, which you can see here, which has been cut here. You can see the upper cut end and the lower cut end. Now esophagus, then after that what else we have? Arteries. Which artery now here? This will be the descending aorta. Remember, now you remember the aorta. The ascending aorta in the middle mediastinum, arch of aorta in the superior mediastinum, and descending thoracic aorta in the posterior mediastinum, right? So its branches, origin of its branches only, right? You can see some posterior intercostal arteries which can be seen on the right side. Similarly, they will be on the left side. This is a view from the right side, okay? So descending thoracic aorta and the beginning of its branches. Then veins. Which vein would be there? Here you can see this is the azygous vein which is running here, which drains into the superior vena cava. So you can see the posterior intercostal veins are draining into that, and it will have 2 tributaries, right, which will be draining the veins, posterior intercostal veins, from the left side. And those 2 tributaries are the hemiazygous vein, which cannot be seen here because it will be present deep to the aorta, and the other will be the, you can see part of that only here, accessory hemiazygous vein. So we have hemiazygous vein and accessory hemiazygous veins. Nerves. Vagus nerve will be there. So vagus nerve has to reach the abdomen. It will be by forming a plexus around the esophagus. So we will have the right and the left vagus nerve, which will then form anterior and posterior vagal trunks here, right, at the lower part of the esophagus. So vagus nerve, just remember, it has to reach till the abdomen, so it will be present in the posterior mediastinum also. Then we have some splanchnic nerves. This is the sympathetic chain. So there are some 3 splanchnic nerves which will be supplying the abdominal organs, and they are greater, the lesser, and the least. So that's what you can see here. These are the splanchnic nerves which will be going through the diaphragm to reach the abdomen. Then we have thoracic duct. Thoracic duct begins in the abdomen and then passes through the diaphragm, ascends up in the posterior mediastinum, crosses to the left side at the level of sternal angle, ascends up in the superior mediastinum. We saw that. So thoracic duct will be also present in the posterior mediastinum. And then we have mediastinal lymph nodes. So only one tube here, esophagus. Artery, which one? Remember, descending thoracic aorta. Veins, which one? The azygous system of veins. Nerves, which one? The vagus and the splanchnic nerves. Those nerves which have to reach into the abdomen. Then thoracic duct is there and mediastinal lymph nodes are present. Coming to applied aspect, a condition, mediastinal syndrome, what exactly it is? It is actually compression of mediastinal structure which gives rise to a group of signs and symptoms. A group of signs and symptoms together is known as a syndrome. So here the compression of mediastinal structures occur, And what could be the cause for that? Bronchogenic carcinoma could be there, aneurysm of aorta could be there, or enlarged mediastinal lymph nodes. They could be responsible for compressing certain mediastinal structures. So what will be the effect here? What will be the clinical features? First is engorgement of veins in the upper part of the body, especially because of compression of superior vena cava. Why not inferior vena cava? Because inferior vena cava has a very short course. It just passes through the diaphragm and enters the right atrium, right? So there, any of those structures cannot compress the inferior vena cava. So which vein will be mainly affected is the superior vena cava. So there will be engorgement of veins in the veins in the upper part of the body, they will become dilated. Dyspnea, compression of trachea, that is going to lead to difficulty in breathing. Dyspnea, compression of esophagus, difficulty in swallowing will be there. That is dysphagia. And then hoarseness of voice. Why this occurs? Because of compression of left recurrent laryngeal nerve, right? So recurrent laryngeal nerves, they supply the muscles of the larynx, most of them. So there will be hoarseness of voice also there. So that's all for this video. Thanks for watching, and if you have not subscribed, please subscribe my channel so that I can put more such videos. And if you want the questions and answers in anatomy, all types of that, then visit the website, that is anatomyqa.com. Thanks once again.